James Meeks, pastor here at the Salem Baptist Church of Chicago, and I am so excited to be back with you on Faith in Crisis. Tonight is going to be an epic night. We have some special guests, and I can't wait to get to them. Can't wait for them to tell you what they've been doing to fight this pandemic. I pray that everybody has been keeping the faith. I pray that everybody has been trusting God and helping each other. I pray that everybody has been remembering your neighbor. Remember that in this time of crisis, everything is not about us, but everything is about our neighbor. So let's open up in a word of prayer. Our Father and our God, we love you. We thank you for your love, your kindness, and your great mercy. We praise you, God, because you've given us an opportunity to call on you. We realize that over 100,000 people have lost their lives in our country just in the last few months. But yet, you've counted us among those who are privileged to have our lives, and we pause to praise you. We do pray for the family of those who've lost their lives, and I ask, Holy Spirit of God, that you would comfort them. Those who are sick, those who are in hospitals, I pray for them. Our first responders, our elected officials, I pray for them. I pray that you would give them wisdom and knowledge. And then I pray for our nation as we are facing another tragic police murder. I pray for the family of George Floyd and all of those who've been affected. Be with us tonight. We worship you in Jesus' name. Amen. Well, tonight we have some special guests with us, and I am so excited to have them here. Let me introduce and first of all and say publicly to the president of the county board. I've never had a chance to say this to you, but my heart was so overwhelmed when you came to my father's funeral. I will never forget it. It meant so much to me that you were here, you came, you sat through the entire service, and just your presence meant so much to me and my family, and we want to thank you so much. The president of the county board is here tonight, and I'm going to give her a chance to say good evening. President Tony Pretwinkle.
Thank you very much, Pastor.
Get your mic. That's your mic or somewhere. That's all right.
Thank you very much, Pastor. I appreciate the opportunity to be with you this evening. As you know, we are deeply involved in trying to deal with the pandemic. County, half of our budget is in healthcare, and our flagship hospital, Stroger Hospital on the near west side of Chicago, every day, almost half of our patients are COVID-19 patients. So we are struggling to meet the need for health care at the same time that we're looking toward recovery.
Well, we think that you have been doing a remarkable job leading our county. And Cook County, in size mass, where do we rank in counties across the country?
We're the second largest county in the country after Los Angeles. Los Angeles county has about 11 million people. We have 5.2. The reason we're second is that every borough in New York is a separate county. So the 5 boroughs in New York are each a county. So we're the second largest county just because New York is organized in that way.
Okay. Well, I can't wait to get to the president. She's going to tell us all about what we've been doing in the county. Those of you who are watching on Facebook Live, I ask that you would get your questions ready. If you have questions and you want to ask a question, you know that we do our best to fumble to get to your questions and then to present them to our guests. We have with us Rod Martin, who is from Agile Technologies, and they specify they do testing. And so, Rod, just say good evening to us, and then soon we'll tell everybody all about what you do, and you can introduce the doctor that's with you.
Fantastic. We appreciate the opportunity to be here. Agile Technologies is a company that has responded with testing, with PPE. Also, there's an interesting connection with the IT services that we provide as well. But we all play a part. The public community, the private business community, the faith-based community, and there's coordination that we can do, all play our individual parts to be a part of the solution. And here with me I have Dr. Shante Griggs, who's one of the doctors on our team.
Good evening, everyone. Hello, President Preckwinkle.
Good evening.
Thank you so much, Reverend Meeks, for having us. And I can't thank Rod enough for bringing me as well. He came to our institution. I'm currently the president of the National College of Naturopathic Medicine. It's on the north side of Chicago. And through an affiliation through another healthcare organization is when I met Rod from Agile Technologies. Now, I'm also a doctor of pharmacy, so I have a background on the other side of medicine as well. And when he was explaining some of the things about the testing, and what intrigued me was the fact that it was much simpler than some of the testing that we had heard of on, in the media. And so I was interested to know more, and here I am.
Wow, I can't wait to get to all of this. I feel so healthy. President Preckwinkle has the largest health facilities in the county. You guys are deep into health. And so I just feel so healthy sitting in between all of you all. I just feel like my life expectancy. I looked at the line in my hand and it just started running longer because I'm sitting here with you all. Well, Madam President, thank you so much for being here. The county has been involved since day one in a rapid response, trying to get your hands on what's going on. You guys got all hospitals ready. You had to get PPE ready. What is it that you want the people in the county to know and in the Chicagoland area to know about what the county's work is presently at this time with the virus?
Well, first of all,
You can have that's it.
thank you. I should remember my mic here. First of all, I'm very grateful to be joined by Dr. Rachel Rubin, who is one of the co-leaders of the Cook County Department of Public Health. And I'm going to ask her to speak first to talk about what the Cook County Department of Public Health does, and in particular, how it's responding to this pandemic. Dr. Rubin?
Thank you, President Preckwinkle, and thank you, Minister Meeks. I appreciate joining you this evening. So what does the Cook County Department of Public Health do? We have many functions, but bottom line is that we are focusing on the health of communities, not sort of individual, even though I am a physician and I do see patients on a regular basis. It's not individual patient care, it's the care of communities. And we do that with a health equity lens. We are focusing on the kind of initiatives that we have to make sure that we pay a special attention to our brown and black communities, our elderly communities, homeless, the communities that are the most disenfranchised in our communities. And the kinds of things that we do are anything from chronic disease prevention programs, including smoking cessation, healthy homes, and then we do all kinds of regulatory things. We also do emergency preparedness, but we do regulatory things. So that's the inspection of restaurants and tanning salons and swimming pools and septic systems and wells. And also the biggest thing that is related to COVID is that we have a large unit that focuses on communicable diseases, which are all of those diseases that healthcare facilities and doctors' offices and institutions need to report is if they have a case of measles, of mumps, of sexually transmitted infections, or of course, COVID-19. And our communicable diseases unit, with the support of frankly everybody in our department, we also have one thing I don't want to forget is our public health nursing, where we take care of tuberculosis patients. That's the only clinical function we have in the health department, but we also do all kinds of outreach with lead-poisoned children and newborns that were born with developmental challenges. And we have home nurses that go and interact with those families and children. And everybody is basically focusing on COVID predominantly right now while we're still trying to do our other work. And in our communicable diseases unit, we're responsible for paying attention to all of the new cases that come through our doors that are reported via lab systems. We then reach out to these positive cases and try to find out everybody they may have been in contact with, close contact with. And then ideally, we want to touch those contacts by calling them and making sure that they understand about being in quarantine while the case remains in isolation for a period of time until they're no longer contagious and they are well. And so this requires, right now, we can't do all the contact tracing that we need to do because there's so many new cases that we are having each day. But as we are getting this under control and we are seeing less positive new cases each day, and we have more testing going on out there throughout jurisdiction, which is basically the majority of suburban Cook County. The city has their own health department that we do work with, but they are separate, and that's the Chicago Department of Public Health. But we do basically the same things in the suburbs. And what we now will need to be doing is just stepping up more and more contact tracing as that number becomes more manageable. And we now have funding so that we can hire people to then work with us and do that tracing for us, or with us, let's say, as part of our workforce. And how are things with COVID right now? We are seeing still anywhere between 200 and 400 new cases a day in the suburbs, and maybe 300 to 500 new cases a day in the city of Chicago. And we are still seeing deaths every day. And unfortunately, we met a high milestone yesterday in terms of a number of deaths. They exceeded, the medical examiner's office exceeded the number of deaths yesterday than they had seen in an entire year in general. We also have exceeded in our health department the number of positive cases of any one particular disease than we see in all of our diseases combined in a year's time. We have exceeded that by a magnitude of several. And so these are unfortunate benchmarks, but I think we have definitely peaked, and we were beginning to see less new cases and less deaths each day. Less hospital beds are being utilized for COVID positive patients, less intensive care unit beds. So all of these are really good signs. And tomorrow, we are going to be entering phase 3 of the Restore Illinois plan, which is the plan of the governors to slowly open up our communities and our society. And the city of Chicago isn't quite at stage 3. They will reach that probably within the next, I would imagine, 2 to 3 weeks. But suburban areas will be opening up a little bit more tomorrow compared to where we've been now. Still have to wear masks, still need to wash your hands frequently, still to maintain that 6 feet of physical distancing from others except your immediate family members or people you live with. But certain stores will be allowed to be opened. Eventually, there will be dining allowed in restaurants as long as it's outside dining, not inside. And the tables have to be 6 feet apart. Pools are still closed. Other kinds of sports are still prohibited unless you can maintain that social distancing. That's why golf and tennis outdoors will be allowed if masks are worn, at least for the golf, and that you maintain that at least 6 feet of social distancing. So we want people to enjoy the outdoors, but to do it safely. And it's our job in the health department to monitor that and to make sure that people are safe.
Madam President, will the counties, opening up the county be any different from opening up the city other than the date that it starts? I mean, is it basically parallel, the same rules for opening the city as opening the county?
I guess I'd say yes. It depends on what stage you're at according to the governor's stages. But as Dr. Rubin has pointed out, the county is in a little better shape in being close to opening than the city. The city is more densely populated, and of course that makes it more difficult to manage the social distancing and to mitigate the effects of the disease. But I just want to express my appreciation to Dr. Rubin and to Dr. Kiran Joshi, who are co-leaders of our Department of Public Health. This has been an extraordinarily challenging time for them, and I'm grateful for their good work.
This is a pandemic that we've never seen before in our lifetime. We saw it the last time 100 years ago, but none of us were here to see it. And so what has been the most challenging part about your job during this pandemic?
Well, first I'll tell a little story. So we have a neighborhood bookstore, a used bookstore called Powell's, and they have what they call remainders, books that are left over by publishers, right? So in December, they had a book called Pandemic 1918, which, given what I was hearing from China, I picked up. And it's a story about what happened in the pandemic 100 years ago. And we also had an influenza pandemic that went on actually from 1917 to 1919. And the critical message of the book was that those leaders who took advice from their public health experts and tried to keep people from gathering in large groups. It was in the middle of the First World War. There were activities to support our troops abroad called Liberty Bonds. The federal government were selling bonds to support the war effort. There were, celebrations of the victory at the end of the war and so on. But those elected officials who listened to their public health experts and discouraged the parades, discouraged the public celebrations where hundreds or thousands of people would gather, had much lower infection rates and death rates than those that ignored the advice of their public health professionals. So one message, if I needed it, from the book was listen to the people who know what they're talking about, your epidemiologists, your doctors. And so that's what we've tried to do in Cook County, follow the advice of our healthcare professionals.
Well, I'll give you another one that goes along with that, and that is someone said last week, even on Gilligan's Island, they listen to the professor and not the millionaire. And so we're always supposed to listen to our health professionals. And I want to stay with health, but I want to come with this question real quick. And do you have any reaction to George Floyd and what happened in Minnesota? I mean, it's the same story over and over and over. Unarmed black man being killed by white policemen. But what were your thoughts about that?
Well, first of all, I came to Chicago in 1965 to go to school. And I have believed my entire life in Chicago that the police could murder black and brown people with impunity. And I would point out that Jason Van Dyke, who was convicted of murdering an unarmed black man, was the first police officer in 35 years to even be accused of murdering a black man. So we live in a city in which the lives of black and brown people are not valued. They're dirt cheap. And as a result, we do not take seriously police murdering our black and brown residents. As I said, when there's a 35-year separation between charges against police for murder, you know that the city doesn't take seriously police murders.
Yeah,
So I grew up in Minnesota, so I know the Twin Cities pretty well. Go back a couple times a year to see my family who are still there. And what impressed me about the difference between the response in Chicago to the Laquan McDonald murder and what happened in Minneapolis is that within 24 hours, the mayor of the city had fired the 4 police officers who were involved in this murder. Within 24 hours. Now, if you'll recall, there was video available of what happened to Laquan McDonald, but it was covered up, right? And the only reason we know about the video is it was forced to be released by a judge. But believe me, the police had the video. So there was an effort to cover up and lie about what happened. And in Minneapolis, what happened was that there was an acknowledgement immediately that this was intolerable behavior, not just firing the people, but requesting an FBI investigation. So I think that's an important difference. You also saw, however, the police responding with tear gas and rubber bullets to the crowd. So it is a situation that, a nonviolent demonstration that kind of got out of hand, and surely the police, I think, responded inappropriately to, but that's another story.
This is happening all over the country, and we must do something about it. Let me ask you one more question before I get to testing. I want to talk to you all about testing. Does it appear as if when we look at the pandemic of 1918, the second wave was worse? The second wave wiped out way more people than the first wave. To either your doctor or to you, Madam President, do you guys think that there's going to be a second wave? And do you think that the second wave, no doubt, is going to be worse than the first?
Well, to your point, in that 2-year pandemic 100 years ago, there was an initial impact, and then there was kind of an echo later, right? And the modeling that I've seen predicts the same thing, that even as we gradually now see a decline in cases and deaths, we will in the fall, in November or December, see another uptick. And the magnitude of it is to be determined, but the modeling that I've seen, all the modeling I've seen, says that we'll have several peaks, not just one. Dr. Rubin, do you want to comment?
I agree with your assessment. No, there's little doubt that there will be another surge, another outbreak of this virus. But what we do now will mitigate how severe that next wave will be, or the next several waves will be. And that determines our behavior as communities and the policies that are in place and the support that we get, especially from the federal government, but also our state and local governments as well, and public health, is what we can all do to help communities to abide by the appropriate public health guidance, because that will decrease how big that next surge will be, how many new cases we will see, how many new deaths we will have to suffer from. So what we do now will depend on how severe that next wave will be. I can't tell you when it's going to be. There are predictions that it might be in the fall, but we don't even know yet whether this virus will behave like other coronaviruses or like influenza viruses, where they seem to be seasonal and peak in the fall when the weather gets cooler, and then decreases over the summer months as the temperatures rise, even though that's not the only factor, obviously, that causes these cases to go down. A lot of what causes the cases to go down is what we are doing in terms of public health controls and what we're doing in our communities. So yes, there will be other surges. Hopefully not too many more before we get a viable, effective, safe vaccination. But even that, we don't know how long that's going to take either.
Wow. So testing. Let's talk about testing for a minute. And Rod, I want to start with you. What got you into testing? How did your company, Agile, how did you guys get into testing? What kind of testing do you do? And then when we're actually going to have a test tonight, you guys, live on stage. We have 2 people that are going to get tested. They're going to get their results back tonight. I don't know if they're going to share their results, but when they get them, I'm going to go and ask them to whisper it in my ear, or can we share it? But anyway, talk to us about your testing.
Absolutely. Thank you so much. And I just appreciate the efforts that have been done by President Preckwinkle's office. And we certainly hope whatever it is that we do for it to be a coordinated effort. So I got into it because I was tapped on the shoulder from some people who knew about some things that I did in advocacy here in Chicago with students, down in St. Louis with the Justice Project with Dr. Christy Griffin and Andrew Young, down in Atlanta with the Southern Christian Leadership Council. So I very humbly say some people thought that my heart was in the right place. Then some people thought that my head was in the right place because I had the fortunate experience of being the infrastructure project manager for the state of Georgia in 2015 with the implementation of the Affordable Health Care Act. So that benefited 2.5 million people in 154 counties with 300 and some odd locations with about 40,000 administrators or so. So I led an effort to consolidate the integrated eligibility system that brought in people into one system instead of 10 for different state agencies. Let's fast forward a little bit, and I did some work with Takeda Pharmaceutical to roll out a global project over 340 sites in 102 countries, dealing with oncology research and access to scientists and researchers for oncology research, drugs, manufacturing and such, and then some additional things. Ultimately, I saw that I had to, I'm from Chicago. I'm from the South Side. I went to Mount Carmel High School, Illinois State, went to school right at St. Eltharita, right on the South Side. I had to get involved, and I had to do something because there was a gap, there was a chasm in what was happening. So ultimately, the first thing that I did was I had a few scientists, an analytical chemist, and an environmental scientist take a look at the testing that were out there with me. We evaluated them. They evaluated the independent research by which the tests were created, and and how they were evaluated. We chose the rapid test by API, Abacus Pharma International, because that company had been producing rapid tests for 10 to 15 years. It's a test that gives results in 15 minutes and has a very high accuracy rate.
You don't drink bleach, right?
I don't touch bleach. I would not advise that to anyone. I would not.
Okay.
I would not
All right.
advise that bad advice.
All right, as long as that's not the cure, go ahead.
Absolutely. The other reason, getting into it, was that those of us with the ability to do so should get involved. From community-based organizations, public officials, private business, commercial partners, and testing is the linchpin. So there's testing, tracing, and tracking. There's another part that's in there that has not been talked about a lot that has to do with the data that needs to be available. So I'm speaking to our particular methodology. I've noticed some things with the testing that happens right now. There's a lot of testing with PCR testing with the swab that everybody's familiar with. They drive through, they're administered the test. I've heard in some instances that people are allowed to self-administer. It's a very uncomfortable process to start with, but self-administering is not effective because you have to get into the sinus cavity to collect DNA, which is what the test measures. That's number one. The test that we provide is just like a home glucose test that a lot of people use to check their insulin level. So it's a finger prick. Additionally, there's a gap in not just the number of tests that are delivered, but the issue becomes how long does it take people to get their results back? And if they are positive, how long does it take someone to be in contact with them? So the methodology that we have in place deals with it in a completely different way. Because we get results right there on the spot within 15 minutes, the people that we hire to do the testing will also be certified to do tracking, the tracing. So they're going to document right then and there and get many more data points than anyone could get a week or 2 weeks or 3 or 4 weeks later.
And plus 4 weeks later, you could have exposed yourself or exposed the virus to a lot of people if you had it.
Absolutely. And at that point, it's hard for people to remember, who was I within 10 feet of? Who did I, 6 feet? Who did I spend more than 10 minutes with?
All right, it's almost 6:30, and so I want to make sure that we get the results in today. I have two individuals who work here at our church, our youth pastor, John, and my own daughter who works in communication, Jasmine. They are going to come forward, and they are going to get tested. So what is it that you're going to be doing to them? And while you test them, the President and I are going to continue to talk about testing from the county's end. But what are you going to be doing to them? And the camera will be showing what's going to happen. But what are you going to do?
I'll talk through it really, really quickly.
All right.
Because it's a really comfortable, quick process. We're going to make sure their finger is a clean surface. We're going to take a lancet, get a few drops of blood, drop it into the well, add a few drops of reagent, wait for the results in about 10 to 15 minutes, and I guess we'll be talking to you right after then.
All right. Well, when the results are in, you let me know that the result. You could put your mic down. And ladies and gentlemen, you are seeing it here live at the House of Hope. I've never seen a live coronavirus test before, and so you're getting ready to see it. And you guys can walk over to the table and where everything is set up. Jasmine and John are there. They have their they have their mask on. They're excited about their test. Madam President, in the county, we're doing a lot of testing in the county. So where are we? And and I told them make sure that she stays. How many testing sites do we have, and what are we doing? Are we doing the swab? Are we doing blood? Or what's the difference?
Well, so first of all, let me just say, testing for the general population is not on our plate.
Okay, great.
We're testing people at the jail.
Right.
Okay, that's our big congregate facility, and I always say jails are petri dishes. So we've got to be very careful there about containing the virus and being careful that new people who are coming into the jail don't have it. We're testing at the jail. We're testing at Providence Hospital, which is our hospital on the south side of Chicago, and we're testing at Stroger Hospital on the near west side. So we're testing our patients and our employees in all three locations. So detainees and staff at the jail, patients and staff at Stroger and Providence. But the state is responsible for publicly supported testing across the state. So it's on the state's plate. And let me ask Dr. Rubin
Right.
to tell us a little bit more about testing.
Dr. Rubin, we're on you. Dr. Rubin, can you hear us? Lisa, make sure Dr. Rubin is not.
Yes.
Oh,
So
wait.
test. Yes, I can. Can you hear me?
Yes,
Yes,
we can
thank
now.
you.
Go ahead, Dr. Rubin. We got you.
Can you hear me?
Yes,
All
we can
right,
hear you.
good. Thank you. Yes, testing. President Preck. Okay, very good. So yes, President Preckwinkle is correct. Those are where we are mainly doing testing. Also, testing is being done in all of our community health centers, but not for anybody who is not a registered patient of that clinic. We are hoping to eventually try to provide further testing to community members out of select numbers of our health centers, but the state is the one that is really driving community testing. And so the state has several testing sites themselves that they run via the National Guard or other personnel that they have. And they're drive-through sites or walk-up sites. And there's several of them throughout the suburban area, and I think there are some in the city. The state has also provided certain federally qualified health centers, which are scattered throughout the city as well as the suburbs, and has provided some of them testing supplies so that they can test community members in their catchment area. And the biggest support that the state is giving right now is providing testing for every single long-term care facility in the state of Illinois. So that includes all nursing homes, homes for developmentally disabled individuals, other kinds of congregate group homes. And they are providing testing for every single one of those sites as we speak. They are sending out testing kits, which includes the materials needed to do the testing, which are the swabs and the tubes that have the reagent, the chemical in it, and the packaging materials, et cetera. And most of those tests up until recently have been done by the state lab. And there are 3 state labs in Chicago, Springfield, and Carbondale. And they also now have recently entered into a contract with Quest, one of the bigger commercial labs in our area of the country, to do analysis of those tests. And the turnaround time with the test is not nearly as quick as the tests that we're seeing being administered right now. But the tests can come back usually within a day or two. It usually only takes a few hours to do the test, but they have a backlog. And so there have been delays of several days or more, especially with some of the commercial labs in terms of getting results out. But that is improving as more and more labs are standing up. And another thing that's nice is that all tests are free. If you have insurance, your insurance will be billed. If you do not have insurance, you will not get paid for it because there are federal monies to reimburse facilities that are offering the tests.
All right. Well, that's good to know that all tests are free. Let me ask you a question, President Preckwinkle, as it relates to the county and the jail. There was a movement afoot, and what I try to do here with Faith in Crisis and the conversations that we have is not to stir up controversy. That's not what I'm trying to do. I'm trying to help people at home learn valuable information that they do not know. But there was a movement afoot that some people were saying that we should just let people out of jails because it is a petri dish. And
So let me just say, we've
Yes.
done everything we can to reduce the jail population, because it is a petri dish, by releasing those accused of nonviolent crimes. Nonviolent crimes. And when I came in office in 2013, there were, on a daily basis, between 10 and 11,000 people in the jail. Over the last year, through the good work of all of our stakeholders, Chief Judge Evans, the state's attorney Kim Fox, the public defender Amy Campanelli, Tom Dart, the sheriff, Dorothy Brown, the clerk of the court, working together, we'd gotten the jail population down to about 6,000. Again, people accused of nonviolent crimes, and accused, not convicted. You understand the detainees in the jail are people accused, right? I think 14% are serving a sentence, which means 86% are accused. The overwhelming majority are accused but not convicted. So, working together over the last year, we've been working on this since 2013, but in particular over the last year, it's been about 6,000 people in the jail. When the epidemic started, there were 5,600 people in the jail. We worked hard with all the stakeholders. It's now down to 4,200 people in the jail. But there's some people who need to stay in jail. Let's talk about some of the people who've succumbed to COVID-19 while in jail. One of them was a person who was accused of multiple cases of molesting children. One of them was accused of attacking a police officer. I mean, we mourn the deaths of everyone who succumbs to the disease, but there's some people who are never going to be released from jail. I'm not going to argue that people who are accused of attacking police officers or abusing children, we ought to let free because there's a COVID-19 pandemic. I'm sorry, they're going to have to stay in jail. But we have done everything we can, working with all of the stakeholders, to be sure that people accused of nonviolent crimes are not in the jail, because we know what a dangerous place it is in the midst of a pandemic.
I don't think that most people know how hard it is to be a public official. I think that, it's easy to sit on the sidelines and say what public officials should be doing, but these decisions that you all have to make are really, really tough, and I applaud you for that. Should everybody in the state of Illinois, in the city of Chicago, or the county of Cook, to the best of our ability, should everybody be tested? I was on calls today where they're calling for everybody to go and get tested. I remember when we first started testing, they said only those who had certain symptoms should get tested. And now they're saying that there are some sites where they have 400 ability to test 400 people, and only 100 people are coming through. So where should we be on urging people to get tested?
I should let Dr. Rubin speak to this, but
Doc-
up to this point,
You speak and then let us speak.
sure. Up to this point, I mean, I haven't encouraged people who have no symptoms to go get tested, because we didn't have enough tests to test the people who had symptoms. Right. You know what I'm saying? So, and we still don't have enough tests to do testing on demand. Dr. Rubin?
Yeah, I agree. At this point, we still do not have enough tests for tests on demand. That being said, I think that there are certain categories of asymptomatic individuals who should seek out testing if it is available in their communities or readily available through their physicians. And that is people that are in increased risk of either being exposed. So they may be one of those asymptomatic individuals, but they work in a profession where they are highly exposed, such as first responders and certain types of healthcare workers. Also, anybody that works in a long-term care facility. And the state is actually providing testing for all residents and are actually mandating that management of these long-term care facilities ensure that residents are tested, but all staff also need to be tested. Also, people that have long-term chronic diseases that might cause them, if they do get the coronavirus, to have a more serious case of it. That being said, we still are having difficulties with not having enough tests, or even if there's enough lab capability, there aren't enough of the swabs or enough of the reagents, the chemicals that are needed to develop the tests. And that is getting better, but I think we're still not quite there yet to say everybody should go get tested. Also, we don't want people waiting in long queues. You want people to be maintaining that physical distancing and to maintaining as much time at home as is possible. I mean, if you go to work, and then come home and stay home. And so we're not quite at the point of having everybody tested. It would be important to try to ramp up as much testing as we can, but in a controlled fashion.
Here's my concern about testing, and it might be a question that nobody can do anything about. I was tested last week. I was tested negative. My wife and I, we were tested. We were negative. So happy that we were negative. We come in contact with more people than perhaps most people, even during the pandemic. So we felt that we should get tested because we're around people. And then I was going to go and see my mother, and I wanted to make sure that, when I was tested, I wasn't carrying anything to my mother. But the point is, I was tested last week, and last week I was negative. That doesn't mean that I'm negative right now.
It surely doesn't.
It doesn't mean that between last week and right now that I didn't come in contact with somebody who was asymptomatic or somebody with the virus. They gave it to me, and I could have it. And so because I was negative then, I walk around with a false sense of security that I'm negative, when in actuality, I may not be. With that in mind, how often do we test the county workers? You said we tested everybody who worked in the jail, and then do we test them repetitively?
Well, I defer to Dr. Rubin. I know that in some instances we're doing screening. For example, I go on Mondays to our Emergency Operations Center in Oak Forest to thank the good people who've been working seven days a week around this pandemic crisis. And whenever I go in the building, they take my temperature. They have one of those little guns, and anybody who has an elevated temperature, of course, is suspected that they might have the disease. Okay, Dr. Rubin, do you want to? So that's screening. That's not testing, right? Temperature testing. Go ahead, Dr. Rubin.
Yeah, at this point, again, in part because of capacity, we are not testing all people even all healthcare workers, but indeed the screening is there in front of all of our hospitals. When you walk in the building, you get screened with, if not with a temperature check, at the very least with a symptom check. So you're asked about whether you've had a fever, and we want people to be self-monitoring that work in these high-risk professions. So actually even though I'm doing televisits with my patients, a week from tomorrow, I'm going to start seeing patients again in person. So I should be testing my temperature twice a day and keeping track of my own symptoms, and symptoms including whether you feel like you've had a fever or hopefully checked your temperature, cough, shortness of breath, chills, feeling a loss of sense of smell or taste, are very prominent symptoms that we've been finding are connected with coronavirus infections, but they also can indicate other kinds of infections like a cold, for example. So we want at least temperature checks. So that's a screening that we do. And exactly to your point, Reverend Meeks, is that you can be negative today and positive tomorrow. So there would have to be serial testing on a regular basis. Every few days, workers would have to be tested. And we do not have that kind of capacity at this point to do it in that way. So we are substituting by something that is not a perfect method, but it is certainly helpful, and that is by doing screening on everybody. And at the very hint of any minor symptom of any sort, you then get tested.
I've worked with the county for a long time, President Brett Winkle. I remember Dr. Ruth Rothstein, and we did so much work together, and she was and I just often wonder what she would have been doing if she were here right now.
Well, Ruth Rothstein, as you know, was the chief executive officer of our health and hospital system for many years. And she was clearly a force of nature. Somebody I was pleased to call my friend. And she, after she left that position and before I became president of the county, she transitioned out and we asked her to serve on the governing board for the health and hospital system. So that's how I knew her. But she surely was a champion of the system and a promoter of the system. And I know that she would be right in there swinging now as we're struggling with a pandemic.
Yeah. So I mentioned her because she was such a great lady and she worked so hard. And I want somebody to mention me when I die. I, I hope I have lived such a life and I've made one or two contributions. Don't let my memory just die. But she was a great person. What about jobs? Are there any jobs as it relates to tracking and tracing? Has the pandemic, I know that it's taken away a lot of jobs, but has it created jobs that the county is now offering?
Well, we've gotten some money from the federal government, and I'll let Dr. Rubin speak to it. I think it's $41 million to do contact tracing. But as she pointed out earlier, we can't do it yet because the magnitude of the pandemic is such that there's no way that we could keep up with the contact tracing. So we have to, I think we're hiring managers, then we're going to hire teams, contact tracers, and then train them, right? And hopefully by the time we've hired the managers, hired the contact tracers, and trained them, we'll be at a point where we can put them to use. I think the recommendation that I heard, Dr. Rubin, was 30 contact tracers for every 100,000 people. If we have 2.5 million people in suburban Cook County, that's a lot of contact tracers. Dr. Rubin, you want to speak to where we are in the effort to build our contact tracing team?
And how much will they make when contact tracers are hired, and where should people apply? Dr. Rubin?
All right. Some of those answers I have now and some I don't, but we will Yes. Hi. Can you hear me?
Oh, yeah, we got you.
Yes, we can.
Am I online?
Yes, we can hear you.
Okay. Very good. Yeah. So some of those answers I have. Good. So some of those answers I have for you now, some not quite yet. First of all, that calculation, which is what we had been basing our projections on, is these 30 contact traces for every 100,000 people in the population. And we have downward calculated that based on seeing how many cases we were seeing on a daily basis, even at the height of this particular outbreak, this particular rise in cases. And think we probably don't need quite that many, but what we want to do is, in addition to having contact tracers, as President Preckwinkle said, is that we're putting together teams. So it won't just be tracers, it will also be community outreach workers. Because individuals, let's say somebody tests positive, and we reach out to them, we get their history, we find out who they've been in touch with so that we can then get in touch with the contacts of the case, and we make sure that the case is able to be in isolation and the contacts are in quarantine. They have to be able to maintain that isolation and quarantine. Isolation means really putting yourself separate from everybody else in the household. So hopefully even not even sharing a bathroom if that's at all possible, and not being able to leave your room, basically. And quarantine means you can move around your home, but we don't want you to leave your home. And that may be very difficult for many of our families and our households throughout the county because people live in multi-generational houses, or they live in small apartments with several individuals. Also, people may not have family members who can, or friends who can do shopping and bring them food while they are in isolation or quarantine. And so we need to have working with organizations that can provide those kinds of resources to individuals that need that. Also alternative housing, which we already have a program for. But if there's respite housing for healthcare workers who have been highly exposed to cases and don't want to go home because they're afraid they may infect their loved ones. And so we give them a hotel room to stay in as they go to work. And then we also have alternative housing for people who might be positive, but not so sick that they need to be in a hospital, but where they can still more or less take care of themselves and also arrange hotel rooms for them as well as those wraparound services. So the contact tracing programs are also going to include, besides the managers and the actual tracers, but also resource coordinators and also community outreach workers, because we also want to mobilize and work with community organizations to help us do this. And we are in the process of laying out all of the moving pieces. And we want to give a living wage, not just a minimum wage, but a living wage. And so we anticipate the entry level contact tracer position to get at least $20 an hour. And then if you're a supervisor, you might get a little more. And then obviously we have more senior people that have other expertise and specific skills, and they will get different salaries. And we anticipate that these are meant to be full-time jobs for a period of time. The grant runs for a year. It might even be extended. They'll hope that we won't run out of money at the end of that year. But the point is that we really want these to be good jobs that will provide decent skills to people that get the jobs. And we are providing a living wage with benefits. We don't yet have a hiring system set up yet, but that will be coming soon. So I can't yet tell you, go to our website and click on this link and you can then go to the site that is our hiring portal. We don't yet have that. And that will be up and running as soon as we can possibly do that. But we need to get some managers on board that will help us plan out the rest of what we need to do in the most efficient and expert fashion.
Wow. Well, those of you who are watching, keep looking at that website, keep looking at the county and what they're doing, because those jobs are coming soon. Madam President, hey, how are we coming on the test results? The test results are in? They're done. All right. So excuse me a minute. I was going to ask the president a question, but excuse me a minute. I'm going to go over to, okay, everybody has microphones. So are we able to reveal? Is there anybody that's going to reveal?
I will.
All right, you can take your mask off. Nobody's close to you.
Well, you know.
All right, so reveal your results.
I'm negative and never had it. So I had no antibodies and no virus as of right now.
All right, so Jasmine is negative. She's never had it. John, are you ready to reveal? If it's going to help, all right. And you can demask.
You got to move away from me.
All right. Yeah, okay. If she got to move away, this is not good. No, but he said you have to move. So if you have to move, it's not good. You better move. So what are you going to say, John?
Well, my test came back that I have IG, right? So that says that I had it previously.
That's correct.
And so I was hospitalized back in March for having it. So I do have antibodies in my system that are fighting against it.
All right, well, you guys can come back to the table. I want one of you to explain what he said through his mask. So Jasmine does not have it. John has had it. He was in the hospital, and he does have the antibodies. So I guess he is valuable to somebody because he has the antibodies, and so maybe they'll kidnap him and they'll clone him because he has the antibodies. So what does that mean, what he just said?
So what Jonathan had is an evidence of infection, but the IgG antibody. That means that his body reacted to it and fought it off. That means that the infection is beyond a certain point as well. So he would not be infectious to others past a certain point. But there's not conclusive data on whether he can be reinfected. That's the other thing.
Can he infect Jasmine right now? That's what I want to know. That's my daughter, and so I want to know if I have to get her away from there, get over here on the couch where I am. Can he infect her right now?
He should be beyond that point.
Okay, all right.
However, so that test that he just took validated what he already knew. If he did not already know, then guess what? He would have been one of that 35% of people who's an asymptomatic carrier. We can't identify them because typically they have no symptoms, no cough, no temperature, and everything else. That's some of the limitation of the testing. Testing usually tries to fall into a few categories where it tries to be good: accuracy, speed, cost. There's a fourth item that we talk about that many others don't, and that's data points. So while we were actually over there, we were able to do the contact tracing to talk to him about where he's been, who he's been with more than 10 minutes, who he's been with within 6 feet, who he may have been in contact with, what public transport he may have been on as well. So ultimately,
Well, let me ask you
sure.
this. There are people who are asking me, can we have the test here? Is there any way we could have a test like in our parking lot or in our facility? Or because there are a lot of people who want instant results and they want to know, can we have a test here?
Absolutely. With the space that we have in the sanctuary, we could literally do hundreds of tests at the same time. With the speed at which we can do them, the typical tester could do probably 5, maybe 6 tests per hour. It takes that amount of time because remember, we're giving them results within 10 to 15 minutes, and we're able to do the contact tracing right on the spot, which gives you the data points. If you've ever been into the network operations center for a network or for a security operation, there are monitors. We would be able to provide that data on a real-time basis. That way, someone who's making executive decisions can get out in front of it. Instead of reacting, we can determine by zip code.
If I didn't know any better, I think you would pitch it to the president.
Well,
if I didn't know any
well,
better. But
we-
anyway, we'll save that. We'll save that. I am so grateful that we were able to provide the opportunity for those of you to see live on television. People get the coronavirus test. One was good. One found out that they had it, and they're able to do the data tracing. I want to close with the president. President, we have 2 minutes left. I want you to be able to say to your constituents anything you want to say to them about what we need to know during this pandemic.
Well, first of all, thank you very much,
Thank
Pastor,
you.
for inviting us this evening. And I want to thank Dr. Rachel Rubin, who's one of our co-leaders of the Cook County Department of Public Health, along with Dr. Joshi, Dr. Kiran Joshi. I'm grateful to both of them, and I'm particularly grateful that Dr. Rubin joined us. First and foremost, I want to stress that as we move to open our city and our county, it's very important that people continue to be vigilant. You heard Dr. Rubin say it's not clear how long this is going to be with us, but it's years and not months. So we need to wear masks. We need to stay 6 feet apart. We need to continue wash our hands all the time. We need to continue to do all the things that we can personally do to mitigate the transmission of the disease. That's the first thing. And the second thing is we've got to steel ourselves for the long haul. This is not, there's no magic here. And we're unlikely to have a vaccine by the end of the year. It may be longer than that. I remember having a conversation with Dr. Joshi and Dr. Rubin in March when we began our efforts to combat the virus in earnest, and both of them shared that it would be at least 18 months before we had a vaccine. Some vaccines are promising, but they have to be tested on human beings, and you have to wait to see what the side effects are of the vaccine to see if it really protects people, and if so, what are the perhaps unintended consequences of giving the person the vaccine. So we've got a lot of work to do, and I want to thank the brave people who've volunteered to be subjects of those tests because they will help all of us. But it's important that all of us understand we have to continue to be vigilant. We have to understand that we're in this for the long haul, and we cannot, as so many people I know are stir crazy and anxious to get outside and to be with their friends and family again, but we have to continue to be careful. Otherwise, we're going to see a dramatic increase in the number of cases.
Rod, give us your website. How can people reach you? How can people contact you?
It's www.agiletech.com. That's AGILETECH.com. Or 877-424-4534.
All right, those of you who are watching tonight, we want you to know that we love you. We thank God for you and your family. Wear your mask. Be safe. Remember all of the social distancing rules. Our president has a tremendous social distancing post where she's putting her arms out and holding a basketball. You have to stay that far apart. We thank all of you. Those of you on Facebook, we're signing off right now as well. Thank you so much, President Brett Winkle. Thank you so much, Doctor, for being with us. Thank you, doctors, and thank you all for being with us, and good night.